Transparent Health, keeping patients safe. Nights and weekend care. This short film will provide information you should know regarding the difference in hospital care at night and on weekends. Not only is staffing at a minimum, but the caregivers that you know and have been comfortable with may not be readily available if you need them.
We just hunkered down and hoped that by morning somebody who knew what they were doing, who could help us, would come. Because we certainly had realized that there were not many people around on Sunday. It was very, very quiet.
At 12:05 p.m., Lewis becomes unarousable. His family is asked to leave the room. Lewis goes into full cardiac arrest. Chest tubes are put in by the resident, who believes Lewis has a pneumothorax. A code is called at 12:20 p.m. For an hour, a team of surgeons, nurses, and residents try to revive Lewis, but they are unable to do so.
Then they came to get us and said, the doctors wanted to talk to you. One of them introduced himself as the doctor on call. Well, we'd never met this doctor. We'd never even heard of him. And he said, we lost him. That made no sense to me. It didn't fit into anything. And then they told us that they had no idea why Lewis had died, that their chief resident had seen him the night before and hadn't found anything wrong. And that was the first we knew that the doctor the night before had not been the attending that we had requested.
The patients and families need to know that they need to be especially vigilant during the night times and on weekends, because hospitals are just not staffed in the way they are during the week, during the day. In the case of Lewis, the outcome may have been very, very different if he had been seen during the week, and if that had happened, say, on a Tuesday or Wednesday, the outcome would have been very, very different.
Researchers have shown that coverage by a different physician at night was more predictive of hospital complications and errors than was the severity of a patient's illness.
There aren't as many people around to cover the same number of patients, so you may have residents who are cross-covering other services with patients that they're not familiar with during the week. And if one of those is desperately sick, they need to know about that at the handoff so that the new team is essentially hitting the ground running when it comes to look after the patient.
I had no idea who, if anyone, the nurse answered to. I had no idea how to go above her head, which I certainly would have done. All I knew to do was to ask for higher level physicians, which I did persistently. We had no idea who anyone was. They were all people in scrubs or white uniforms of one sort or another. We didn't know an orderly from an attending. We had no idea who was who. It was only much later, after I got Lewis's chart, that I was able to sort out the junior resident. The entire time I had thought was a nurse.
Well, a lot of the bad things happened over a weekend, which is always a difficult time because even though there is cover, it's not necessarily fully staffed with attendings. They're mostly going to be working from home on call, and although they're available and certainly can come in to deal with problems, they don't know there's a problem if they're not called.
We had no idea that hospitals didn't have the same level of care on the weekends, or that it really would just be the intern and no one else. So that is something that patients need to be aware of, night and weekend care.
There are fewer doctors and staff in hospitals at night and on weekends compared to weekdays. Patients and family members need to be especially vigilant during these times. Ask your doctor for his or her contact information should you need them in an urgent situation. If he or she is not the doctor on call, find out who is and obtain the same information for the on-call physician. If you are told the hospital staff or his office will contact him or her in an urgent situation, politely insist that you would like to have the information yourself and that you will use it responsibly. Ask if the hospital has a rapid response system and how to use it. Hospitals accredited by the Joint Commission are required to have a rapid response system. Ask hospital staff to describe how it works and how it is different from calling your doctor. Always know who you are talking to. Clinicians should introduce themselves, but do not be afraid to ask, "What is your name? What is your position? What responsibilities do you have in my care? Are you in training? And if so, what level of training have you reached?" Remember that you have a right to ask for a higher level physician at any time. Many caregivers will be involved in your treatment. You and your family are the only people who are the constant presence. You will have information and insight that these caregivers will not have. Do not hesitate to communicate any concerns you may have or to raise them up the chain of command if you believe your concerns are not being addressed. Transparent health, keeping patients safe.